Hello and good evening, everyone. I hope I'm audible. My voice is loud and clear. You can respond in your chat box. Yes. Okay, so good evening, everyone. Welcome to the live session, like the first live session on dental anatomy. So as you all know, dental anatomy and dental histology are like one of the simple and basic dental subjects. Of course, there is like lots of numerical data involved in dental anatomy. Like you have to study about the chronology of the tooth and the dimensions of the tooth. And that can be a little bit challenging, but comparatively, it's easy to understand the concepts in dental anatomy. And once you understand the concepts, the subject also becomes really easier. Okay, so for NEET exams, dental anatomy together with dental histology, you can expect a total of like, okay, is it audible now? Is it audible now, doctor? Anyone else having the same problem? My voice is audible. You can use the chat box for answering. Am I audible? Please use your chat box for answering. Okay. Okay. Anyone else having the same problem? Like my voice is not audible? Oh, okay. Okay, doctor. Okay, then we will continue. So as I was saying, for the NEET exams, dental anatomy together with dental histology, you can expect a total of like 14 questions. And from dental anatomy alone, you can expect somewhere between like 6 to 7 questions can be expected. Now, if you look at the recent NEET exam that happened in the March 2024, like there were like lots of image-based questions were like there, but there were like two image-based questions just from dental anatomy. Okay, so like what are the type of image-based questions that can ask in dental anatomy? I will tell you. One type is the age estimation questions. They can either give you a picture or they can give you an OPG. Okay, and ask you to identify the age of the patient. Okay, that is one type of image-based question that you can definitely expect in dental anatomy. If you look at the previous years, these age estimation questions are frequently repeated. Okay, like in every year, there will be like one age estimation question. Now, the second type is they can give you a picture of a tooth. Okay, like from a labial surface or a lingual surface or from a occlusal surface, and they can ask you to identify which tooth is it. Okay, that is another kind of image-based question that you can expect in dental anatomy. Now, the third type is like they can give you a particular surface, like they can give you a occlusal surface of a molar or a premolar, and then they can mark a particular structure in that premolar or molar, and then they will ask you to identify which structure is that, like which cusp can it be, or which ridge it can be, or which fossa it can be. Like that also they can ask the questions. Okay, so these are the three types of image-based questions that you can get in dental anatomy. Okay, so like compared to the clinical subjects, these basic dental subjects are comparatively easy. Mostly only we get the straightforward one-liner questions only. So try to score maximum marks in such simple subjects, okay? Because the difficulty level of the clinical subjects can be like really tough. They can make it like really tough. But these basic dental subjects, there's a limit to the difficulty level. So try to score maximum in these simple subjects. Okay. Now coming to the session, like let's make it an interactive session. After reading the question and the options, you can put your answers in the chat box. Even if you are like doubtful about the answers also, no problem. Like try to answer, or if you don't know anything about the question, then you can also put I don't know the answer in the chat box. No issues. Okay, no judgments here. So first question, identify the structure marked in the image given below. Okay, I had already put this question in the WhatsApp group. This question is important because this same question was asked in the recent NEET MDS 2024 question paper also. Okay, so that's why I'm giving importance to this question. So what is the answer? Yes, doctors. Yes, Dr. Muhammad Shakira. Yes, Dr. Gauri, Dr. Hridya. All are right. Yes, Dr. Farhana. Yes. Yes, Dr. Fida Fatima. All are right. It is a triangular ridge only. Okay, so this yellow shaded part here, that is the triangular ridge. Now let's look at so if you look at the teeth, a teeth will have elevations and depressions. Okay, that's how broadly we can classify the structures of the teeth. A teeth will have elevations and depressions. These elevations include like lobes, cusp, tubercle, ridges, mamelons, cingulum are all elevated structures. Depressions include like fossa, sulcus, grooves, pits are all depressions. Now, what is this ridge? Ridge means any linear flat elevation of the teeth. Okay, so if you can see this linear flat elevations of the teeth, they are called as the ridges. There are four types of ridges that are commonly seen. One is the marginal ridge, then we have the oblique ridge, then we have the triangular ridge and the transverse ridge. Okay, so these are the four types of ridges that are commonly seen. So let's look at each ridge one by one. So these are the marginal ridges. Okay, like the name suggests, they will be in the margins. Okay, there'll be like mesial margin and distal margin for the teeth. And these ridges will be like flat elevated structures that are seen in the margins of the teeth. They are the marginal ridges. Next is the oblique ridge. Oblique ridge is a characteristic feature of maxillary molars. Okay, oblique ridge is only seen in maxillary molars. That is one distinguishing feature of maxillary molar that is used to distinguish this maxillary teeth from the mandibular teeth. Okay, so that is the oblique ridge, and this oblique ridge, they usually run from the distrobuccal cusp to the mesiopalatal cusp. These cusps are also very important because they can ask like this also, like this oblique ridge, which two cusp it is connecting, like that also the questions can be asked. Okay, so you should know the cusp also. It connects the distrobuccal cusp to the mesiopalatal cusp. Okay, like if teeth is there, then it is like a crossing ridge. Okay, it is like crossing obliquely the teeth. So this is about the oblique ridge. Now coming to the next one, that is this triangular ridge. So triangular ridge, it extends from the tip of the cusp towards the center part of the occlusal surface. Okay, so from the tip to the center part of the occlusal surface. This is the triangular ridge. Okay, when we connect two triangular ridges together, we will get something called as this transverse ridge. Okay, this is the transverse ridge. When you connect this buccal and lingual triangular ridges together, then you get this transverse ridge. So according to the question, this was the shaded area here. So this is nothing. It is called as the triangular ridge. Okay, if the shaded portion is extending into this surface also, then we can rightly call it as the transverse ridge. Okay, know the difference between the transverse ridge and the oblique ridge. Okay, transverse ridge is like a straight line from connecting between the two cusps, whereas oblique ridge is between the opposite cusps. Okay, so moving on to the next question. Name the cusp form shown in the image below. Okay, which cusp form is showing here? Is it haplodont or triconodont or tritubercular molar or quadritubercular molar? What is it? What is shown here in this image? Yes, doctors, answers please. Okay, so yes, Dr. Adila. Any others? So our human dentition and the structure surrounding it is like one of the most complex structure. Okay, the human dentition, the cusps and the occlusion, they are all the complex structures if you look at the animal kingdom. But there are like primitive forms of the occlusion also, like in the lower animal, like the primitive, in the primitive animals, you can see not much that much complicated occlusion, or the cusp forms will not be seen. Okay, they'll be like really primitive in nature. Okay, so based upon this, the phylogenetic classes. Okay, phylogenetic classes means, yes, Dr. Mohammed Shakira. Okay, so based upon that, based on the phylogeny, that is the evolutionary relationships, the cusp form of the animal kingdom can be divided mainly into like four types. They are the haplodon, triconodon, tritubercular molar, and the quadritubercular molar. Now, if you look at these cusps here, they are just like conical teeth present. Okay, they are just a simple, no cusp are there, just conical shape of teeth is present, and it is not even in occlusion. Okay, so such type of teeth is called as the dentition, is called as the haplodont. Okay, it is option A, haplodont. Yeah, both Adila and Dr. Shakira are correct. Okay, so let's look at the four classes of these tooth forms. One is the haplodont type, then next is the triconodont type, and the third one is the tritubercular molar, and fourth one is the quadritubercular molar. So haplodont is the simplest form of tooth, that is only like single cone-like teeth will be present. Just open and close movements will be there, like a crocodile movement. Okay, like the how the crocodile opens and closes the mouth, just open and close movements will alone be there. No occlusion will be seen also between the haplodont kind of dentition. Okay, next is the triconodont type. In triconodont, as you can see here, three cusps will be there. This was a like a just like a single conical teeth was there, but here you can see three cusps in line. Okay, the center cusp will be the largest one and it will be most pointed, and the other two, the one in the anterior side and in the posterior side, they'll be like very short cusp. Okay, so purely triconal dentitions are not commonly seen, but in rare species of like dogs and in carnivores, you can see this triconodont type of dentition also. Then the third one is the tritubercular type. Tritubercular type means in the molar arrangement, in the posterior teeth, mainly the molar arrangement will be like three-cornered tritubercular arrangement like this. As you can see, this shaded ones are the upper teeth and the rounded ones are the lower teeth. So you can see an occlusion happening here in the tritubercular type. Okay, so this is also most commonly seen in the dogs and carnivores. And last one is the quadritubercular molar, which is the most advanced type of the dentition, where you can see definitely the occlusion that is happening between the upper and lower teeth, and the jaw articulation and the teeth cuspation are all consistent with the jaw movements, can also be seen in this quadritubercular model. Okay, so these topics, this comes under something called as the comparative dental anatomy. Okay, like we are comparing the human dentition with the other animal dentition also. Where this comes in importance is because there was a question that was asked in the recent NEET MDS 2024 examination, like a girl child came to the OPD for scaling. Okay. And on oral examination, her teeth were shaped like a carnivore. Okay. So what type of teeth can it be? Okay. That was one question that was asked in the recent examination. Okay. So you should know these terms thoroughly. Okay. Because such questions related to the comparative dental anatomy is also asked in the recent papers. Okay. Now, moving on to the next question. Identify the type of attachment of the tooth to the jawbone given in the image below. Is it isodont or thecodont or acrodont or plurodont? What type of attachment of the tooth is seen here? Yes, doctors, answers, please. Yes. So, the based upon the, yes. Yes, Dr. Adila. Yes, any others? So based upon how the teeth is arranged on top of the uh, jawbone, the tooth has been classified into different forms. Okay. So as you can see here, one thing that you can notice here is that the tooth is like just like sitting in a jawbone. Okay. There is no root seen. Okay. So what are rootless teeth called? So what is the name of the rootless teeth? Yes. Any others? Anyone can answer. You can use the chat box and answer. Even if it is wrong, it doesn't matter. Okay, we are all in the learning process. Okay, any others? Yes, Dr. Rahul. Yes, any others? Okay, yes, you are right. It is option C, acrodont only. Okay, acrodont is mainly called as the rootless teeth. Okay, so based on how the tooth is arranged in the jawbone, the teeth can be classified into three types. One is acrodont, the second one is pleurodont, and the third one is thecodont. Okay, so acrodont means basically no roots are there. Okay, just like this here. No roots are there. It's like the tooth is sitting on top of the jawbone, just like that. Okay, so this kind of teeth is mostly seen in reptiles and in fishes, and they are not strongly attached to the underlying jawbone. Okay, they can be like if they chew a little bit hard substance, then these teeth can shed off easily. Okay, so such is the arrangement of this acrodont. Now, once the tooth is shed off, the another one will definitely come in its place. Okay, next is the pleurodont. Pleurodont means this is also attached to the jawbone without any roots, but it is attached on the inner and the upper side of the jawbone. Okay, so more area coverage is there for this pleurodont type of. Okay, since larger surface area of contact is there, it is much more stronger when compared to the acrodont type. Okay, so that is about the pleurodont. This pleurodont type of teeth is mainly seen in like amphibians, lizards, and all. Then the last one is the thecodont. That is our human teeth. Okay, so thecodont. Thecodont means the tooth is getting attached to the jawbone with the help of a root. Okay, it is more like a peg and socket attachment. There will be a socket, and to it, the root will be attached firmly. Okay, so this is the most strongest form of attachment among the all three. And this kind of attachment, as you can see, it's seen in the apes and like humans and all. Okay, so that's about the classification. Now, coming to the next question. In the given image, the lobe number 2, this is the lobe number 2, it gives rise to which cusp? Does it give rise to like the mesiobuccal cusp or the distrobuccal cusp or the distal cusp or the mesiolingual cusp? This lobe number 2, it gives rise to which cusp? So this lobes are and cusps are different. Okay, lobes are the developmental centers. Okay, they are like the growth centers for the cusp. Okay, so this lobe only will give rise to a cusp in future. So which is it? Yes, Dr. Rahul. Yes, Dr. Fida. Any others? Any other answers? Yes, Dr. Adita. Any others? Okay. So this lobe number 2 will give rise to the mesiolingual cusp only. Okay, so let's see what we had already discussed about the elevations and the depressions that are present in the teeth. Elevations, the lobes, cusp, tubercle, ridges, mamelon, cingulum are all included under the elevated structures that are present in the teeth. And depressions, fossa, sulcus, grooves, and pits are included under the depressed structures in the teeth. Now, these lobes are nothing but they are the growth center in the development of the crown of the teeth. Okay, they are just the growth centers. From these growth centers only, these cusps are developing. Okay, so based on that, there are like three lobes, like three types of lobes from where the teeth are developed. Okay, there is like deciduous incisors. Okay, these deciduous incisors are like very small shaped teeth, so they develop only from one lobe. Okay, so these deciduous incisors, they develop only from one lobe. Now, there are other teeth like the deciduous molars and the our permanent central and the lateral incisors, canines, and the premolars. They all develop from four lobes. Okay, they all develop from four lobes. Now there are teeth that develop from five lobes. Okay, you should know this because there are only like very small amount of teeth that develop from five lobes. One is the permanent first molars. Okay, mainly the mandibular molars. Okay, these mandibular molars, they develop from five lobes. And here the maxillary molar is also given as five lobes, but this is including the cusp of Carabelli. Okay, if it is no cusp of Carabelli is present, then only four lobes are involved in the formation of the maxillary molars. Now you have the mandibular second premolars. This mandibular second premolars, if they have like three cusps, this mandibular second premolar, they have like they can have two cusps and they can have three cusps. If they have three cusps, then such premolars, they arise from five cusps only. And the primary second molars also arise from five lobes. Okay, so one lobe, the development of the deciduous incisors are mainly from the one lobe, and the four lobes, all other teeth like the permanent incisors, permanent canines, first premolars, and the maxillary molars, all except the mandibular first molar, are all developed from the four lobes. Okay, five lobes, only special teeth like the permanent mandibular first molar and the mandibular second premolars and primary second molars, they all develop from the five lobes. Okay, so that you have to remember. Okay, now if you look at the picture that is given in the question, so out of these thing, the smallest cusp is seen in the number 3 region, right? The smallest cusp is seen in the number 3 region, that is the distal cusp. Okay, so this is a, you know that this is a mandibular molar picture, occlusal area, because five cusps are there. Now, out of these five cusps, the smallest cusp is seen in the number 3 region, so that is the distal cusp. And so this is the distal area and this is the mesial area. Now, how to identify the buccal area and the lingual area? The area where we can, which is pointing towards where the three cusps are seen, that will be usually the buccal area. Okay, so here the three cusps are seen on that side, the three cusps are seen, so that will be the buccal area and this will be the lingual area. Okay, so this is the mesiobuccal cusp, which is the largest cusp for a mandibular molar, and this is the distrobuccal cusp. Distal cusp is the smallest cusp in the mandibular molars, and this is the distrolingual cusp and the mesiolingual cusp. So lobe number 2 gives rise to mesiolingual cusp only. Each lobe will give rise to each cusp. Okay, based upon the name of the cusp only, we call the name of the lobe also. Like mesiolingual lobe will give rise to the mesiolingual cusp. Okay. Now, moving on to the next question. What fraction of life do we spend chewing with primary teeth? Is it like 5%, 6%, or 7%, or 8%? Okay. So primary teeth, they erupt into the oral cavity by around like 6 to 10 months of age. And the first primary teeth to erupt is usually the mandibular central incisors. Primary mandibular central incisors, they are the first teeth to erupt into the oral cavity. From that time, the last teeth to shed off is the maxillary canines. Okay, they have the longest tooth, so they are the last tooth to get shed off. They get shed off around like somewhere like 10 to 11 or 10 to 12 years. Usually they shed off by that age. Okay, so from this 6 to 7 months till those 10 to 11 years, we are mainly depending on this primary dentition only for our mastication purposes. So what fraction of life do we spend chewing with primary teeth? Okay, it involves a little bit of calculation, so I'll tell it myself. It is option B, 6%. Okay, so if we consider like the average lifespan of a human being is like 70 years, then the first teeth that is to erupt into the oral cavity, that is the mandibular central incisors, that they erupt around like 6 to 10 months of 10 months of age. And the last teeth to shed off is the maxillary canines, which usually shuts off by like 11 to 12 years. So the 6 months to 12 years, around like 11.5 years are there. So out of the 70 years, if you look at the 11.5 years, then around 6% of our lifespan we are spending with the primary teeth. Now, moving on to the next question, identify the tooth numbering system that is shown in this child. Okay, I hope you can see this, the B, C, D, E, F, G, H, I, and all till the S, it is shown here. So what type of tooth numbering system is shown in this child here? Yes, Dr. Rahul. Yes, Dr. Hridya. Yes, Dr. Adila. Okay. Yes, Dr. Farhana. Yes, Dr. Fida. Yes, Dr. Shakira. Okay. Yes, Dr. Adila. Okay. So all of you know it. It is a simple question. Okay. It is the universal notation system. Okay, so let's see the two numbering systems. One is the universal system, Sigmondi or Palmer notation system, and the two-digit system or the FDI system. Universal system means in the primary dentition, we use the alphabets, and in the permanent dentition, we use the numbers. Okay, so starting from A to J for the maxillary arch, and from K to T for the mandibular arch. Okay, it starts from the first quadrant, last molar, and it in the mandibular arch, it starts in the left side. Okay, that you have to remember. Now, sometimes questions can be asked like, under the FDI system, which tooth does 3-3 refer to? Okay, like that also question can be asked. So you should know like, okay, 3-3 refers to the canine that is present. Okay, you should know that. Now, this is the permanent dentition universal system, starting from 1 to all the 32 teeth are there. Then this is the Sigmondi system, where we use it with the help of the symbols, but those symbols are difficult to enter in the keyboard, so they discarded that system. And now the FDI system or the two-digit system is most popular, like adopted by the WHO also. So in the FDI system, as you know, like two numbers are used. 5 refers to the upper right quadrant, 6 refers to upper left quadrant, and 7 refers to like lower left, and the 8 refers to lower right, like that. Okay, what we commonly use in the clinic also. Now, next question. In molars with radix paramolaris, extra root is seen towards which side? Okay, so like we have the extra cusp. Okay, so the extra cusp that is seen in the maxillary molars in the palatal region, they are called as the supernumerary cusp, which is the cusp of Caraville. Now, like that, there will be supernumerary roots also. Okay, so the roots, extra root that is seen in the mandibular molars, they are called as the radix endomolaris. Okay, they are called as the radix endomolaris. Okay, I'll show you. I'll show you the images. So this step, okay, this is the mandibular molars, and as you can see, an extra root like this can be seen. These are the supernumerary roots, and these supernumerary roots, they are called as the radix endomolaris. Okay, so if this extra root is present in the lingual side, okay, if this extra root is present in the lingual side, then it is called as the radix endomolaris. But if this root is present on the buccal side, then it is called as the radix paramolaris. Okay, so in the question, it was like, in the molars with the radix paramolaris, extra root is seen towards which side? Okay, is it lingually or mesially or distally or buccally? The correct answer is buccally only. Okay, so the remember the terms. Lingual side, it is called as the endomolaris. Buccal side, it is called as the paramolaris. And this type of root, supernumerary roots, are most commonly seen in the Chinese population and in the Eskimos and in the American Indians only. Okay. Now, moving on to the next question. Identify the tooth based on the occlusal surface image given below. Okay, so this occlusal surface is of which tooth? Is it right mandibular permanent first molar, or left mandibular permanent second molar, or left mandibular permanent first molar or right mandibular permanent second molar? Yes, yes, doctors, answers, please. Okay, doctor. Yes, Dr. Rahul. Anyone else? Yes, Dr. Fida. Anyone else? Yes, Dr. Fida Fatima. Yes, others? Okay. So as you can see from this occlusal surface, there are five cusps. Okay, there are five cusps. So you can rule out the second molar from these options. Okay, second molar, mandibular second molar will usually only have four cusps. Okay, it is the first molar that has the five cusps. Okay, so all the mandibular first molars will have the five cusps. And this distal cusp is towards this side. Okay, so we can see that this is the distal side. This is the shortest cusp. So this is the distal side. And this is the mesial side. And as I have already mentioned, the three cusps will always be pointing towards the buccal side. Okay, so this will be the buccal side and this will be the lingual side. So the answer is option A, right mandibular permanent first molar. Okay, so next, like I had already mentioned, this is the picture of the or the occlusal surface of the uh, first molar, and this is the picture of the first molar, and this is the picture of the second molar. Okay, these two are the pictures of the first molars, and this is the picture of the second molar. So as you can see in this from this picture itself, five cusps are involved here, only four cusps involved here, and you look at the pattern of this groove, that is central groove that is passing through. Okay, here it is mainly like a Y-shaped pattern is seen here, whereas here it is usually a plus-shaped pattern in the second molar region. Okay, so if you look at the differences between this mandibular first molar and mandibular second molar, I will always suggest you to learn like this by comparing two teeth. If it is like a central incisor and lateral incisor you are studying, compare between the two and list out the differences between the two and make a table like this, and it will be easy for you to learn and you will also remember things. Okay, so always compare and learn. So this mandibular first molar, if you look at it, it is usually can have a pentagonal like shape like this, whereas the mandibular second molar, it will be usually a rectangular shape like this. And the occlusal aspect, if you look at it, the cusp pattern is usually in this Y shape. Okay, so this is the Y shape cusp pattern of the mandibular first molar, and this is the plus shaped cusp pattern that is seen in the second molar. Like I had already mentioned, five cusp, four cusp are here. So the distal cusp makes the fifth cusp, and here no distal cusp will be present. So this occlusal feature of this first molar, first mandibular molar, that is usually seen in the apes and in the monkeys and all the other also. So it is mostly called as the Dryopithecus pattern. Okay, Dryopithecus is like a evolution. Okay, previous ancestor of the apes and all. So uh, in that animals also we were able to see this kind of pattern. Okay, like the five cusp molar and the Y pattern of the cuspal pattern is usually seen from that ancestors itself. Okay, so this pattern of this mandibular molar, that is also called as the Dryopithecus pattern, and this molar, the first molars are also called as Y5 molars. Okay, since they're showing the Y pattern and five cusps are there, they are also called as the Y5 molars. Okay, and if you look at the roots of this mandibular first molar, they are usually divergent, whereas it is usually closer together in the second molar. And the mesial root is like wide buccolingually, whereas the mesial root is slightly narrower than in the first molars. Okay, moving on to the next question. Which of the following is not a succedaneous teeth? Is it 1, 6, 1, 3, 4, 5, or 4, 4? So which of the following is not a succedaneous teeth? Yes, Dr. Adila. Yes, Dr. Rahul. Anyone else? Yes, Dr. Fida. Any others? Any other answers? Okay, so the teeth in our oral cavity can be divided into two types. Okay, one is the succedaneous type of teeth and another one is the non-succedaneous type of teeth. So what do you mean by this succedaneous and non-succedaneous? Succedaneous means these teeth, they already have a predecessor. Okay, that is, before they come into the oral cavity, another particular teeth was already present in their particular position. Okay, and after time they shut off, and after the shedding off only this particular teeth, okay, this succedaneous teeth that erupts into the oral cavity. Okay, so which of the following is not a succedaneous teeth means it is the molars only. Okay, so the permanent teeth, like I had already mentioned, succedaneous and non-succedaneous teeth are there. Succedaneous teeth means they erupt into the position of a predecessor. Okay, like the incisors, the canines, the premolars, they all erupt into the position of a deciduous teeth. Whereas the non-succedaneous teeth means there's no predecessor for that. There's no teeth that is present in their place in the previous time. Okay, so the main example are the molars. Only first, second, and third molars are examples of non-succedaneous teeth. Now next, the ratio of width to height of the crown of permanent maxillary central incisor is. Okay, you have to remember the dimensions for answering this question. The ratio of width to height of the crown of the permanent maxillary central incisors. Again, a calculation-based question is this. So the answer is option B, 0.8. Okay, I'll show you how. So this is the mesiodistal diameter of the crown of the central incisors. Okay, so if you look at it, if you compare the anterior teeth, this central incisors have the largest mesiodistal diameter of the crown. Okay, they are like broad when compared to all the anterior teeth. So their mesiodistal diameter is 8.5, and this is the cervico-incisal length of the crown. Okay, so the width to height ratio they were asking. So it is like 8.5 by 10.5, which is 0.8. Okay, so rarely such numerical and calculation-based questions can also be asked from dental anatomy if they want to really make it tough. Okay. Now, moving on to the next question. Based on the image given, identify the areas marked 1, 2, and 5. Okay, so 5 refers to mainly this arrow pointed region. Okay, so what does this 1, 2, and 5 shows? Yes, answers please, doctors. Yes. 1, this is a premolar. You know, it is a maxillary first premolar. 2 cusp, 2 roots are there, and bifurcation is also there. So this is a maxillary first premolar. What does 1 represent? What does 2 represent? And what does 5 represent in these images given here? Yes, Dr. Rahul. Yes, Dr. Adila. Yes, Dr. Farhana. Any others? Okay. So I'll tell you the answer. It's actually option C, buccal cusp, palatal cusp, and mesial marginal groove only. Okay, so this is the maxillary first premolar, 2 cusp, 2 roots. The buccal cusp will always be larger in the maxillary first premolar when compared to the lingual cusp. So this largest and longest cusp is the buccal cusp, and the smaller one is the palatal cusp or the lingual cusp. And this groove, okay, this groove is the hallmark feature of the maxillary first premolar. Okay, you will not see this groove on any other teeth. Okay, this is like the main distinguishing feature of the maxillary first premolar, that is the mesial marginal developmental groove. Okay, so this is the mesial marginal ridge that is present here. So from the central groove, there will be like extension from the central groove to this mesial marginal ridge that is crossing this mesial marginal ridge, and it is creating a depression here. Okay, so that groove is the mesial marginal groove. Okay, so maxillary, this is the one that is shown in the image is the maxillary right first premolar, and there are like two features that are like exclusively there only for this maxillary first premolars. The first one, as I had already mentioned, it is the mesial marginal groove. You can see this is the central groove. Okay, and this there will be an extension of the central groove to the mesial marginal ridge that is called as this mesial marginal developmental groove. Okay, now another feature that is like mostly seen only in this maxillary first premolars is this mesial developmental depression. Okay, so when you view the teeth from the mesial surface, you can see a small kind of depression here in the above the contact area and below the cervical line. Okay, you can see a small depressed area here. Okay, and this depressed area will be extending to the root surface also. Okay, so that is called as the mesial developmental depression. Okay, so these two features, remember, in the maxillary first premolars. Okay, maxillary first premolars, these two features you should remember, because some features that are like the distribution features of the teeth, they can ask questions from that also repeated. Okay, so these two features are like particularly seen only for this maxillary first premolars. One is the mesial marginal groove and the other one is the mesial developmental depression. So the maxillary first premolar, they are like roughly trapezoidal in shape, the crown, and the lingual cusp is smaller than the buccal cusp. The mesial developmental depression is present on the mesial surface of the root, and the occlusal surface is like roughly hexagonal in shape. And the mesial contact area, they lie in the junction of the occlusal and middle third. Most of the mesial contact areas, they lie in the junction of the occlusal and middle third, and the distal contact area, they lie in the middle third. Okay. Now, like this, there are other distinguishing features for other teeth also that you should know. Okay, because that is very important. Okay. The first one is the in the mandibular first premolar. Now we had talked about the maxillary first premolar. Now there is one more distinguishing feature that is there present in the mandibular first premolar. That is the mesiolingual developmental groove. This mesiolingual developmental groove also you will not see in any other teeth, but it is like a characteristic feature of this mandibular first premolar. Okay, so this mesiolingual developmental groove, it is the line of demarcation between the mesiobuccal lobe and the lingual lobe, and it extends from the mesial fossa of the occlusal surface. So if you look at the occlusal surface of this mandibular first premolar also, you'll be able to see a groove-like structure that is seen in the extending to the lingual surface. That is nothing but that is the mesiolingual developmental groove. Now there is another groove that is mostly present in the maxillary lateral incisors. Okay, so that is called as the palato-radicular grooves. Okay, so this is the palato-radicular grooves. They extend from the side of the cingulum and can extend into the root. Okay, so that kind of groove that extends from the side of the cingulum to the root surface, that is mostly seen only in the lateral incisors, mainly the maxillary lateral incisors. They are called as this palato-radicular grooves. Okay, so we have discussed about the maxillary first premolars, mandibular first premolars, and the maxillary lateral incisors. Okay, these three teeth have some special features in them. Okay, you should remember that. Now next, mandibular permanent canine differs from the maxillary permanent canine in which of the following aspect? Is it the labial convexity, or the less prominent labial ridge, or the less prominent cingulum, or all of the above? Yes, answers please, doctors. The mandibular permanent canine will usually have the features that are similar to the maxillary canine, but the features will be like less prominent. Okay, okay, Dr. Adila. Okay, anything else? Others? Yes, Dr. Fida. Any other answers? Okay. Okay, so the right answer is option D, all of the above. Okay. So most of the features of the maxillary permanent canine and the mandibular permanent canine are similar, but the features will be less prominent. Okay, they'll be like a little bit relaxed and smoothened in case of the mandibular canine. Okay, so if you look at the dimensions of the maxillary and the mandibular canines, um, the actual height of the tooth or the length of the tooth is actually the same only, like the 27 millimeter only, but the mandibular canine crown length is a little bit more when compared to the crown of the maxillary canine. A little bit more crown length is there, but that is compensated in the root of the maxillary canines. Maxillary canine root is like really long. Okay, so and if you look at the mesiodistal width, only like 0.5 millimeter differences would be there. Otherwise, it is like comparatively same only. And if you look at the images of this maxillary and mandibular canines, then you can really appreciate the differences. Okay, so this maxillary canines, they'll be like this is the labial ridge here. Okay, they have a like a really prominent labial ridge, whereas if you can look at it, it's not that prominent. All the features are like less. And if you look at the from the lingual side, the cingulum is like really prominent in case of the maxillary canines. It is less prominent in case of the mandibular ones. And since the cingulum is like less pronounced, the lingual fossa, okay, the lingual fossa and the marginal ridges, they are also like little bit very bland, or like you can see like very smooth in nature. Okay, so that is the all the features of this mandibular teeth will be usually less. So if you look at the crown, the maxillary canine crown is a little bit like 1 millimeter less length than the mandibular canine, but the mandibular canine, the crown will be like long and narrow. Labial convexity will be less prominent in case of mandibular canine. Labial ridge, like I had already shown, it will be also be less prominent. Cingulum will be more of like smooth in nature. Okay, and the lingual fossa is also less prominent. Lingual ridges are also less prominent. And if you look at the cusp tip of maxillary canines will be like in the center. Okay, like in the mesiodistally, they will be in the center. Whereas in the mandibular canines, they will be usually a little bit mesially placed. Okay, towards the mesial side, they will be placed in case of the mandibular canine. That is all the main differences between the maxillary and the mandibular canines. Okay, so that's all for today. Any doubts, doctors? We will continue with the remaining questions tomorrow itself. Are you having any doubts in this session? Okay, if you are having any doubts, you can put it in the WhatsApp group, or like you can ask me personally also. Okay, so that's all for today, I think. Tomorrow also we will have a discussion on the dental anatomy high yield questions. Okay, we'll have a discussion tomorrow also. So if you can have any doubts, you can ask me like tomorrow also, or you can message me and ask us. Okay, so that's all for today, guys. So all the best for your preparations. Do well. Yes, thank you, doctor. Thank you for attending the session. All the best for your preparations. Do well. Yeah, good night.